Okay, let's dig into some really groundbreaking news. It
Mm.
feels like it could genuinely reshape how we tackle severe depression.
Yeah.
If you, listening, have felt that frustration with treatments that just don't last, well, this deep dive into a new McGill study,
Mm.
it's definitely for you.
Mm-hmm.
We're talking about taking a treatment that was already a big deal, ketamine, and making it work. Well, making the benefits stick around much longer.
It really feels like a pivotal moment, especially, for people dealing with the most chronic, treatment-resistant kinds of depression.
Right.
We've known ketamine works fast. It's got that rapid effect. But the big question mark has always been, okay, how do you sustain that? How do you make it last?
Yeah, how do you make it stick?
Exactly. And this deep dive, drawing on this really pioneering clinical study from McGill, plus talking to the researchers involved, it's finally giving us some pretty profound answers.
So our mission here really is to unpack how this combined approach works. Why is it so different? And crucially, what does it actually mean for people living with chronic depression day in, day out?
Mm-hmm.
And maybe the key thing, let's get it out right up front. This study found ketamine works better. It's enhanced when you pair it with psychotherapy and a really specific kind of supportive setting.
Yeah, the setting is crucial.
And the result, relief that lasts, which is, a huge contrast to the usual quick fade out we see.
And what's really striking, I think, is who they studied.
Yeah, tell us about that.
We're talking about individuals with chronic treatment-resistant depression. These are people who, haven't gotten better with standard therapies, sometimes for years. Many are dealing with suicidal thoughts, other really tough mental health challenges. So this isn't mild stuff. It really underscores the seriousness of what this new approach is trying to address.
That really raises the stakes, doesn't it? And ketamine itself, it's been talked about for a while as this rapid antidepressant. Dr. Kyle Greenway, one of the lead authors, he even called it the most exciting antidepressant innovation in decades.
He did, yeah. It created a lot of buzz.
But you hit on it. The mystery was how it works exactly, and the big one, how to make those often profound effects actually endure. So what did this McGill study find that really moved the needle on that durability problem?
Well, the results they reported are, frankly, transformative. They actually measured it an average 30% drop in depression scores right away.
30%? Wow.
Just imagine the relief that provides almost instantly. And on top of that, significant drops in suicidal thinking and anxiety by the time the 4-week program ended.
Okay, that's a massive immediate hit.
Mm-hmm.
But you mentioned durability. That's where it gets really interesting, right? Because standard ketamine, the effects can vanish in, a few days?
Exactly, sometimes very quickly. But here, participants kept feeling better. The improvements continued for at least 8 weeks after the main treatment phase.
8 weeks. That's way more than double the usual.
Yeah.
That's a huge leap for people wanting relief that actually holds.
It really is. And maybe the most surprising part, the key might lie in something that many people just saw as an unwanted side effect of ketamine.
You mean the sort of weird stuff.
Yeah, exactly. Ketamine can cause some pretty intense psychological effects, right? Like altered perceptions, time feeling distorted, sometimes even out-of-body type experiences.
Usually written off.
Traditionally, yeah, they have often been seen as just side effects, things you tolerate to get the benefit.
But this study flips that completely on its head. They found participants who described their sessions as particularly emotional or even mystical. Those were the ones who got the most improvement.
Right.
That's so counterintuitive, isn't it? The thing we thought was just noise might actually be the signal.
It really makes you wonder, doesn't it, about other treatments, too.
How hard was it, do you think, for the researchers to even, consider that, to shift that paradigm?
Well, it's a huge shift in thinking. Their hypothesis now is that these intense experiences, they might not be side effects at all, but actually central to the healing process. They're drawing parallels to classical psychedelics like psilocybin. Dr. Greenway actually said this study is the first to strongly link these specific kinds of ketamine experiences to the benefits in severe depression.
So we might need to totally redefine what a side effect even means in therapy. Maybe some aren't unwanted, maybe they're essential.
Precisely. It suggests it's not just about the chemical, the drug itself, it's the whole experience.
Which brings us to the setting and the support. The study really focused on this. Tell us about that part.
They really did. It was a randomized trial, 32 adults. They got their ketamine infusions, but the environment was carefully designed. Rooms with soft lighting, plants.
Nice. Not your typical clinical room.
Not at all. And depending on the group, they had either curated music playing or guided mindfulness exercises. Plus, importantly, weekly psychotherapy sessions alongside the infusions.
So how did all those environmental bits, the music, the therapy, how did that fit into making it work better?
That seems to be a critical piece of the puzzle. If you think about it, how someone feels in the treatment space, their sense of safety, it can massively shape their response.
Especially if they've spent years in, sterile clinical settings.
Exactly. So, creating a space that feels safe, one that allows for deep psychological exploration during the ketamine experience, that seems key to unlocking its potential.
I heard the Montreal Ketamine Clinic itself is designed like that, with the soft lighting, the greenery.
It is. It's designed for patient comfort, which sounds simple, but the study suggests it's deeply therapeutic. And this whole philosophy, this careful attention to setting and integration, it underpins this framework they developed. They call it the Montreal model.
The Montreal model. Okay, so it's more than just an idea. It's like a practical blueprint developed by Dr. Greenway and Dr. Nicholas Gurel.
That's right, during their psychiatry residencies at McGill. And what makes it unique is this blend. It takes traditional psychiatry, but weaves in strategies borrowed from psychedelic therapy research.
Interesting. And why is that blend so significant for, actually using this in the real world?
Well, its practical impact could be huge for you, the listener, if you care about solutions that actually work outside of perfect lab conditions.
Right.
Dr. Greenway pointed out their study shows this approach doesn't just give longer-lasting relief, but it can be done safely and effectively in real-world, resource-lean public healthcare settings.
Resource lean, that's important.
Very. Places that often see much more complex patients than you'd typically find in, say, tightly controlled research trials. So it's bringing order and structure to a field that Dr. Greenway described as being currently a bit of a Wild West.
Bringing order to the Wild West. I like that. And is it catching on? Is this model being used elsewhere?
It seems like it. It's increasingly being picked up by both public and private healthcare services, not just in Canada, but internationally too.
Really?
Yeah, they apparently just held the first training session on this specific model for about 80 healthcare professionals from all over the world.
Wow, okay, so it's spreading.
It definitely seems to be gaining momentum. And for anyone wanting the specifics, the study itself was just published in the British Journal of Psychiatry, June 18th, 2025.
Good to know. And funded by major health research groups in Quebec, too.
Yeah, strong backing. It really does highlight the potential for this to become more widespread.
Absolutely. The implications feel quite far-reaching here.
They really do.
So if we boil it all down, what's the biggest takeaway from this deep dive? For me, it's that this combination ketamine, plus the right kind of therapy, plus that supportive setting, it looks truly revolutionary for potentially achieving lasting relief in severe depression.
Couldn't agree more.
And maybe the most mind-bending part is embracing, not dismissing, those intense, almost psychedelic experiences. They might be crucial.
Yeah, it really forces a fundamental rethink, which leads to a bigger question, maybe something for you, the listener, to mull over.
Wow.
Given these findings, this new way of looking at healing experiences, what could that mean for other mental health treatments? And maybe even how might it reshape our whole definition of what we even call a side effect in therapy going forward?
Redefining side effects as part of the cure. That is definitely something to think about.